Well, thank you so much for taking the time to be in conversation with me for Shift Happens. And before we get into your very complex shifts that you shared with me beforehand, I wanted to ask you a few questions. What is your current state of mind?
Between relaxed and overwhelmed, I would say most of the time.
Okay, yeah, that's.
Yeah.
And how would you describe your idea of perfect happiness?
Perfect happiness, I would say that's really when you found the people you're happy with and they are surrounding you, and you have things to do that you enjoy to do and they make sense to you and you can build something, but at the same time, have time for yourself and do what your brain needs, your body needs. We are all different. Some people need excitement all day long, and other people just need more. I'm more an introvert. That actually I think I am that. So I love to have time for myself. And yes, that's what I would be happy if that would happen one day in that nice balance.
Yes. Which living person do you most admire?
Oh, wow, that's a difficult question you're popping here on me. A living person that I most admire. Let's see. I'm thinking about the professional people versus the inspirational people. Many of them are dead, unfortunately. Can you ask me this again a little bit later?
Sure. Whenever it pops up, or if not, then not. So in this podcast, we talk about pivotal moments and turning points in life. And you, I imagine, are confronted with this within the outside world of your profession. You're a doctor, you're women's health specialist. You are have a, as I read, a profound background because you're also a functional medicine, well versed. You're highly educated in Chinese medicine, so I'm sure you are supporting women in a big turn in life, menopause. But I'm interested actually in your pivotal moment, and would be great if you could give us some insights from your life.
Yeah, absolutely. So first, can I go back to the person I most admire?
Yeah.
Or is that the point?
No, absolutely.
A living person. So I really think it's actually my teacher, Dr. Rita Marie Loscalzo. So she founded the Institute of Nutritional Endocrinology here in the US. And she has, 20 to 30 years of really build. When the functional medicine realm, when it started, she really started back then. And I think she built like a real, she's really not making it for money anymore. She's really trying to educate more and more providers and physicians and really get the word out there. So I think she's the one. Okay, Dr. Rita Marie Roscalzo. All right, now you want to go back to my own pivotal moments?
Yes, please.
All right. So, like many women, I was in my mid 40s. Had a very busy job. I was working for the University of Maryland. So that was certainly, for what's called here in the US a foreign medical graduate, because I did not train in the US. I was trained in Germany, and I basically came and did my training here for a person like me to really get a job at University of Maryland as faculty. That was pretty cool. So but after like doing this for 8 years or 9 years, I had changed positions there, and I didn't feel it anymore. So, I realized all this, they say they give you like these golden cuffs, golden handcuffs, right? Because there come benefits with it. And I just couldn't feel it at all. I did not understand what this was good for. I had no time, my kids were growing up there, I needed a doctor's appointment with the kids. I could never be there because it was impossible to take time off. So I think that was when I was like, this is not, that's not me. And I had a partner who was like, well, you didn't really take this serious. And I didn't feel that energetic anymore. I had these joint pains and this and that. And I had some terrible back pain. And so really it came all together at that time. And I just realized I didn't want to do that anymore. That it's not me, as shiny as it is. And the moment came, yes, my marriage fell apart during that time too. It was a couple of years, of course, thank goodness that doesn't happen all in 1 year. But when, I realized my support system isn't there and I don't want to do this. And yes, so I separated and I found a new partner at some point. And at that point, that was now a person who really supported me in saying, okay, that is not you. You have to let go. And it was already when I wanted to to build a practice, or in that University of Maryland, I felt, well, let's do like a menopause clinic, right? And there was just no support. It was not what their vision was, and that's fair enough. But then, as a physician, you have to then just to take your consequences. And that's when I kind of, not refocus, but I kind of took that on, this functional medicine view on things, got myself education. I left that position. And there was some, you cannot, in the US, there's something called non-compete. So you cannot just leave somewhere and open your office like 3 miles away. I couldn't do that. So I was kind of banned for 2 years, for 15 miles. Actually, that goes away now, but this was just reality for not just physicians, for many professionals here in the US. So however, my kids were still, in high school, I really wanted to now have these last couple of years to be there for them. So yes, I couldn't just go somewhere and now have a commute of 1.5 hours every day. So kind of snuck my way out of that. I did I started some online education and business, and I started to work just on labor delivery for another hospital system where that was actually possible. So, and then slowly I got, once I had my head on things, then I got, another position offered when now I would they were supporting me in doing a gynecology only, and the menopausal clinic they liked. And of course, I also like vulvovaginal disease. That was the other niche I really wanted to develop, and I didn't really get support from my previous job, where I would have thought, why wouldn't you give me like a great vulvovaginal disease clinic as university? Well, sometimes, we are not heard, and then we have to find our way out. So yes.
Yeah, I actually did organize an event with a think tank here in New York in June on women's health. And the research really depressed me majorly, because I just had no clue how underfunded and under-researched women and women's health have been. And that it's, I mean, of course, a tragedy, and how much pain and suffering could have been prevented earlier if women had been more in the focus. Yeah. And it's still slow. I mean, there are so many startups now, especially in the fertility field, that are being funded and that get funding. And it's, it's been a topic in all, big organizations and conferences all over the world. But yeah, it's still unfathomable for me to how this happened. Yeah. So when you had a progressive idea and it wasn't supported. Yeah, that must have been hard.
Well, you know, go ahead. Well, I want to say it's not, you know, it's these are important steps in life, I think, when you just, and it's, you know, it happened to me professionally, and, you know, because I was also in perimenopause, then menopause, and it's similar to what happens to women, even if they're not professionally involved in that. They're just coming to the point when they realize in midlife, well, first of all, the reproductive function gives up. There are symptoms associated with it. They come often then to realize their relationships are not what they thought they are. You know, I have many patients who tell me about their stories, and it's always like, you know, sometimes it's sad, sometimes we laugh about it. It's often tragic, but then it's good to know there are kind of sisters out there that went exactly through the same thing. So I think that just, you come to this watershed moment in life, and then I think as a patient or as a woman who seeks care, you just need someone who understands what's going on, not just from, okay, you have a hot flash, I have a tablet for you, or you have some GI symptoms, let me send you to the gastroenterologist, right? Or joint pains, well, you know, that can happen, you know, just take it easier. Because women feel there is more behind it. I felt there were just no answers, no good answers. You know, I'm a long-term member in the Menopause Society in the US, and it was eye-opening to me at the beginning because they gave me all the education about menopause that I didn't get from my residency training here. But then, you know, as I became more versed and saw more and more of these women, then I suddenly saw that, you know, if you're just talking data all the time, so, you know, here's the data about heart disease, here's the data, if you do this, that amount of percentage relieves hot flashes, you know, something is missing somehow, right? So, or, you know, then, you know, women are concerned about weight gain, and they give you the data. Well, if you look at such and such 1,000 women, the average weight gain is only 3 kilos. So then, yeah, but what? You know, a woman is still asking why, and then it's just the average. Some gain more. So what? You know, women are asking, why is that happening? This is all great that you can describe it in your data, or what is behind that? You know, the perimenopausal tendency to depression. Why is that? Or what is that dementia? I mean, there's always these, you know, this data, it might get worse or not, and maybe estrogen helps or not, but what are the other factors? Like, why? So I think that's what kind of, you know, heated me up as I approached my own menopausal journey, and I finally felt, well, no, I need some more answers. And that's how, you know, women out there just feel these days when they go to their regular gynecologist. So I have many patients, unfortunately, they come and see me, and they just, you know, they have a young and perky gynecologist, but they just don't want to deal with that menopausal issue. They're really being told still, like, this is just how it is, deal with it. And that's just sad.
Yeah, it's really sad. And with the experience that you have now, I mean, would you go back to universities and suggest that in their education of young physicians, this must be an initial part, not just only for gynecologists, but for every practitioner? I would think. I mean, they at least need to understand the basics, no?
You know, I think they do got that memo, and I think, you know, they get some education about menopause and HRT, but it's just not enough, right? It's, I think, not enough to make these young people, or maybe even primary care physicians, comfortable enough. And then often they don't understand important points that what I feel then someone does give it, but they really don't give it with the right information, and they don't know when not to do it. So, you know, I'm not so worried about that. It's going to be more taught. I think it's going to be taught more. I think what would be my wish is that it would be seen more in an integrative perspective, and actually women referred to other providers for certain things. University of Maryland, for example, did actually a whole department for integrative medicine. So it's not that it doesn't exist, but you know, it's I by accident found them, and they never there was just no interconnection, and it could have been so fruitful in a way. So I think I would wish that more than everything, that people would know there are, well, you know, because if you are traditional physician, I don't think you have to know everything, but just then to know, okay, I'm here at my end, you've done a colonoscopy, this looks all good. And then to say, well, maybe go to the integrative medicine department. Let's just see if they have more time to talk to you about, you know, food sensitivities, potential, you know, nutritional approaches, all of that. Or, you know, talking about the diet recommendations, you know, here in the US, many of the traditionally trained diet counselors, right, dietitians, they just still tell my patients about the food pyramid, basically, right? And patients are just coming back and saying, what is that? This is just so not helpful. And I've been doing this for years and it doesn't help. So I think that would be good, that there are good people out there, though. Then often normal people can't access them because they are only if you have a diagnosed diabetes, you can go and see them. So there are just so many blocks and so many directions.
So many layers, yeah. So
layers.
what is when you felt kind of at your lowest within perimenopause and menopause and after the probably pretty complex breakup, what were hacks, or how did you find out what was good for your body, what was working? Like, did you change your nutrition, or did you, I don't know, started weightlifting, or I mean, how did you for yourself tackle your own body?
Yeah, so for me it was nutrition, and I think for most of my patients I would say nutrition first. So particularly if we talk about joint pains, the fatigue, you know, the weight gain. So yeah, so I found, you know, like that I was very insulin, not really pre-diabetic, that's the thing, not in traditional medical thing, but yes, I did not respond well to any glycemic load. And apparently all my life, because I always had issues with belly fat and all of that. And I suddenly understood why, right? When I ate, you know, a high glycemic meal, I would just put, I was known for that at University of Hamburg, like at the library where we studied, I would put my head on the desk, like after lunch every time, and sleep for an hour. And it took me until I was kind of end of my 40s to understand what that was. So yeah, so I started very, let's say, planned forward, okay, low glycemic nutrition. So I ate enough, but I tried not to get my blood sugar going. You know, many healthy things like rice and quinoa, all the things we think are healthy, and they were not good for me. So in nutrition, it's just a lot of personalization. So I changed that, you know, I tried a gluten-free diet. Even I have to say, you know, in my training, I got myself tested for all kind of things. I don't have a gluten sensitivity. I have issues with dairy. So, but I did all of this, and then, you know, my joint pains really went away, and I lost that extra weight, and I really felt in control again. And you know, this weakness or the muscles, you know, it had a lot to do with stress, definitively, but also just with insulin resistance and elevated cortisol levels. So things can become very complex. But I did, you know, I fixed my stress. I changed my nutrition. And I know I wrote you, there was one thing I think is a funny coincidence. So what really, I mean, all of this I might have just taken, you know, as aging, but I had this terrible excruciating back pain that really, I always had it for a little bit, but it really got so bad. I had like to wear, like, it's called a sacroiliac belt to really hold things together, like when I was in night shifts. So And at some point, I
Wow.
basically realized that this had nothing to do with my stress. It was a skiing injury that that I really got when I was trying to be super mom and kind of doing skiing with my kids at night, all of that. And I fell because I was never a good skier. And this was an injury that just didn't manifest immediately. Something got loose in that joint, and then anyhow. So that got really fixed then later with some nails in my hip, and since then I'm good. The only sad thing about that story only is because no one told me what it is. I had to find it out literally myself. And I'm still thinking, how can, and I'm a physician, you know, I knew where to go, and they gave me these back injections, and I was telling them, people, this doesn't help. Nothing. So then I went, and this is now the one advice I would give everyone. If you have really, you know, musculoskeletal issues, go to a good physical therapist, right? And it might be someone you have to pay and get reimbursement by your insurance, because these people, you know, physicians are great, but they are these, we call them mid-level providers, you know, they are just very hands-on. They have so much experience with bones, and they'll have a more holistic view on many things, because where they get their education, they have a much more integrated view. So that's what I did, and I found someone, and she kind of put me on, you know, telling me actually what that is, that back pain. It wasn't like a slip disc, it came from that joint. So, and then I had to find the right physician to fix that. And it was also like this weird thing, because I literally had to go over a company who manufactured these nails for that type of pain, and they had a list with a couple of physicians in US, and two of them happened to be somewhere in my area. And once I went there, they did, like, you know, I had seen like 5 physicians before, and there that physician's assistant, she checked my leg, she did one movement, and she said like, yes, SI joint. So it's kind of unnerving and sad. And I'm like, how can someone ever, you know, navigate that? So that's what that kind of stuff upsets me a little bit.
Yeah. And especially you. I mean, being a physician yourself, right? And that must
At
have been
university, and you know,
extremely
I had
shocking.
yeah. It was really.
But it's interesting that you talk about the physical therapists. Like, I also had like this really strange hip pain and lower back pain, and I did my Pilates and yoga and everything, and sometimes it was good, sometimes it was bad. Anyway, I can't remember how, but I ended up with a physical therapist who was specializing on the pelvic floor. And I had, I think, 8 sessions with her, gone. And she taught me these like tiny, tiny movements and exercises that have such an impact, basically on the whole body, you know, how your body is held, the female body is held. Yeah.
Yes. I love that you mentioned that. Pelvic floor physical therapist, that is like a specialty that has really been evolving over the last 10 years. I would say they were really hard to find, and now you find even like some change in franchising. But yes, I agree. The pelvic floor, and these women are magicians. Like you're saying, you have pain on the pelvis or on the vagina. Even I send many of my patients, and they show you some release techniques on your abdomen or on. It's this is nothing they train as physicians. So you need a good physical therapist. When anything starts to hurt, really, I always say, don't wait. Really go and get it. You know, don't be like, oh, it's gonna go away. No, don't. Let it be evaluated.
So going back to you and your turning point, 1 second, I have to push this away. And menopause. So you say nutrition has been really pivotal in navigating this time of change. What are 2, 3 other hacks you would share from your own experience or from experience of your patients?
Yeah, so nutrition, sleep, right? Really prioritize sleep. This is, and it might be, you know, counterintuitive, because I know many women are now struggling with the sleep, but focus on sleep. Go to bed, really, and that's lots of there's a great book. It's called Why We Sleep. There are many of these things are actually explained from the neurological standpoint, but we can't unlock our brain from the circadian rhythm, basically. So I think it's really important to understand you have to go to bed prior to 11 p.m. period. It's not like, oh, I sleep a little later, that's going to be fine. No, it doesn't matter, because the brain is so linked to that circadian rhythm. You're not going to go through these deep restorative sleep stages if you just miss these hours prior to midnight. So sleep, prioritizing sleep. And, I have so many patients, and I think now it's so easy, but, I've been doing this a while, and my patients, all smart women, accomplished, it seems to be so hard to really get to bed in time, and to turn off the screen time. But once they do it, it's like they have more energy. So yes, anyhow, so sleep is important, nutrition, movement, it's not just, we always think, yes, sure, we have to move because sport is good. It's so important for our cortisol levels. It's like, we know this now. It's so movement and alone walking. So there are studies that show people who you put on a 6-week walking program, I think it was every day 30 minutes, they basically improved their brain health 2 years. This
Wow.
it's just our body is basically screaming to do the things we kind of were meant to do. We were, meant to be outside in the sun, eat like a natural diet, and to move all day long. So yeah, I can't move all day long either, because I'm sitting a lot on the desk like many of us, but just don't forget it. You have to move. And it doesn't have to be something super strenuous, right? Many patients I met, they come to midlife. Some of them have suddenly more time, and and they're seeing these bodily changes, so they're overdoing it. They are starting to, I always say they start to triathlons, like literally, and then they are surprised that they're even more fatigued. They don't seem to be able to gain muscle. They injure themselves, and they don't lose weight. And the reason really is because the cortisol levels are already elevated in this perimenopausal transition. So the stress hormone levels, that later goes away, but that really means during that time, you need to cut your body a little slack. That means what is much better for you is actually what is much easier. Go outside and walk. Go walk. There's so much data how good that is. Or, do gentler exercise, whatever it is you like. Is it Pilates or reformer, or whatever people like to do? So yes, and and then fun and outlook. So if there's nothing that you look forward to when you wake up in the morning, and there's just nothing left you like to do, you just have your job and all the things you do, it's going to be difficult. So I think we have to have an outlook and find something that gives us joy. And that's something we have to work on and then implement.
Yes. So that's very wise. Thank you. How do you share your knowledge beyond your practice?
Oh, so like my functional medicine. So when in my practice where I'm employed, and I do regular gynecology mostly. So I do surgery actually still. I do vulvovaginal disease. Yes, I prescribe hormone replacement therapy. And of course, I can't turn off my functional medicine head, right? But there's no real time for long explanations or long lifestyle changes. So for women who are really motivated to do that, I have an online practice that I'm still building, but I have clients now. And that's when I really offer, really like the most fascinating of the tests we use in functional medicine to really check what our hormones are doing, what is the gut microbiome doing, what is our metabolism doing, all these fun things, I think, and they give us lots of actionable information. And then, I have the time and I guide these women. I also have some men, by the way. I guide them through this lifestyle change and sometimes some supplements, and I really give them all the insights that we have, how to how to fix the underlying, the root cause issues. Yes.
Well, that's great. I mean, there is, I find that there's a lot of information out on self-care and longevity and health preserving measurements. But I also realized, at least for me, that I start to get a little bit overwhelmed by it, especially on social media, where I am because of my podcast and all the other things that I'm doing. And it's a little bit almost like I was caught the other day and I thought I'm really in a bit of a like self-care stress. And in the end, I'm not really doing, it's not that I'm not doing anything, but I'm so confused. Like one feed says that almonds are good, the other feed says no, they're not at all, because they build up something in my stomach. Then I start reading about this, and so many contradicting messages. Yeah. And even though I think it's really good to become more transparent and to have more people involved and be vocal about it, and especially in the functional medical field and so on, it can also get confusing. So I think it's great if, you know, a doctor can share and mix the classic and the functional medicine and the Chinese medicine and really come up with something that one feels one can trust. Yeah.
Yeah. So there is a lot of, I always say, a lot of garbage out there, and it's overwhelming. So, and it has to do with, so first of all, for the the terms. So functional medicine is not a protected term at all. And so really everyone can get some education in functional medicine and can become a health coach, or so nutrition counselor, one of these things. So that's functional medicine. So it's a root cause. So these are really, I would call them really nerdy people, often hopefully nerdy physicians that just like me want to understand better the things we know from traditional medicine, but kind of add some things to the armamentarium for the things where there's a void in traditional medicine. There is also integrative medicine. Integrative medicine now is actually a recognized board certification. So that is, you have to be, so people don't know all these differences, right? Integrative medicine, these are board certified physicians. I think they probably tend to do more functional medicine, but not necessarily. That's integrative medicine. Basically means you learned how to also integrate, for example, acupuncture, behavioral therapy, all of these things. That is all nice, but it's not really like that root cause approach we do in functional medicine. But naturally, all of these things mix, of course. So how would anyone know? So that is complicated. And then, out there, when you're saying you're confused about social media, because I'm too, and I always raise my eyebrow, but I always think, how would a consumer know what to trust? Because of course, all these people are offering, whatever they're offering, their products, or, there's always a catch and a hook, and they want you to buy something or whatever the reason is. And sometimes it might come from reputable physicians, and often it might not. So it is really complex. I agree. And then in terms, of female health, there is, you can, or it's hormone replacement therapy, for example. You get the very, stone dry information from the Menopause Society. Usually used to be North American Menopause Society, which I love, because I think every woman should really look what is really the data saying. Data is good. I'm not saying data is bad. And then you have, so they actually don't, I don't think they have big internet or social media presence. So people don't see that the most, which they should actually. They are very quiet in the Menopause Society. And then you have the, let's say, anti-aging, what is that? It's also not a board certification. Don't get me wrong. This is also like a line of holistic medicine that started maybe 15 years ago. So these were the ones that started with injections of growth hormones, and kind of the pellet people fall a little bit in there. So again, this is now they're looking at some studies and how do you say, they're marketing their approach to things, which none of this is FDA approved or showed in study it's safe or really reliable. So these people might want, to sell you injections. Again, there's lots of marketing push behind there, but they have a great marketing machine and they put their information out there. So then people think maybe I should get some vitamin C injections or growth hormones, who knows what. And then there is, for example, the pellet industry. These are now the companies that would like you to help your fatigue and your sexual problems with just giving you like these under the skin placed pellets that contain testosterone or estrogen plus progesterone. And they tell you this is now the thing to do. And they're, and I'm not saying this is not wrong necessarily for everyone, but I think these outlets don't really inform about what is the official statement of traditional medicine regarding these things, right? That this is actually not needed. Functional medicine, we would always say, well, why don't we fix why are you having this symptom? So it's very nuanced, and I think it's impossible to understand for a layperson. Even I'm still, sometimes I write newsletters, so I'm trying to explain this to my followers, what all this means. But man, it's complicated.
Yeah. No, it is. And I just realized in myself that how I got caught into this, and got confused. So I kind of cleared my feeds, and I'm sticking to a very traditional moderation diet
good.
and so on and so forth.
No sugar, clean diet, sleep, and move. Yes, I always would say this fixes probably 90% of my patients.
So 2 last questions. In your busy job, how do you relax, and if you feel sluggish or so, what are your choices to energize yourself?
Oh yeah, right now I'm overwhelmed, as I told you, most of the time. But to relax, and if I just need to clear my head, I like to sit in my garden. I'm a very simple person. I like to sit in my garden, look at the bees, literally. That's when I just recharge, and taking a walk. That is something that sometimes I don't want to do it, and I'm just like, Christina, you're so tired. The brain is like completely gone, and I take brisk walks, and that's what I can always do easily. That's how I try to do it. And if if I need an energy push, I like to supplement with some, have you ever read like their mushroom supplements like reishi mushroom or how are the other ones? The king, the king mushroom. Yeah, so cordyceps. So I really always try to, instead of taking like, a cup of coffee, I really try to nourish my adrenal glands, how we call it in the functional medicine realm. So basically really supporting the stress system. And that actually is consistent with, old-fashioned Chinese medicine, since you mentioned it. They also, they are like really always they want to support this original chi, basically. So supporting that. So that's what I do. And sometimes I just go to bed. So if I'm tired at night, rather than doing a workout, I'll go to bed.
Okay, great. Well, Christina, I thank you so much. That was an important conversation. I think we women still need to learn so much more about ourselves. So anybody who's in this field and active I think it's such important work.
Yeah, thank you for having me. That was fun.
Yeah, thank you. Be well. Bye-bye.